bit on, I got hospitals and I'll turn it over to you. Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by our Public Health Director, Claude Jacob, along with City Attorney Andy Segovia, and this is our COVID-19 update for the San Antonio community. First of all, let's take a look at our progress and warning indicators as we've been dealing with the Delta surge in our community like everyone else has. This week, thankfully, the positivity rate has dropped a bit to 13.6%. There's more testing occurring in our community, which is a good thing. However, our case rate continues to go up. That has increased to 69.1 per 100,000 residents. That's a 36.2% increase from last Sunday. And as noted, with more testing, we are finding those infections faster, so we keep all those things in balance. These factors, combined with the higher stress score in our hospital system and the other indicators we're keeping a watch on in the region, means that we're continuing to be in the severe risk category. As far as cases go, today we're reporting 1,254 new cases of COVID-19. Our 7-day moving average has dropped slightly from last time we reported it. It's now 1,174 cases per day, 7-day average. We are unfortunately reporting 5 new deaths this evening. And that means we have now lost 3,772 friends, neighbors, and loved ones to this virus, and we ask you to please continue to keep them and their families in your prayers this evening. Over in our hospitals, there are 1,418 patients in area hospitals. There were 140 new admissions in the last 24 hours. If you've been keeping track of that, that is down slightly from last week when we were up near 200 nearly every day. So we will continue to watch that. 407 people are in the ICU and 245 are on ventilators. As noted, 85% of patients in the area, nearly 9 out of 10 in hospitals, are unvaccinated. 24 patients are children. We do have a new epidemiological report to show to you this evening. You can find it on the covid19.sanantonio.gov website. We know that July has been a challenging month for our community, especially for our frontline workers, frontline healthcare workers especially. In July, Bexar County reported 15,183 new cases of COVID-19 and 35 deaths, which are a trailing indicator. Almost all of that can be attributed to our Delta surge. Hospitalizations increased throughout July, a 385% increase from the end of June 2021 to the end of July 2021. And we know we are also facing challenges here through August as well. This is something worth noting. 20 to 29-year-olds made up the largest proportion of COVID-19 cases, followed by 30 to 39-year-olds. In July, younger age groups also saw an increase in hospitalizations, and in fact, the average age of a hospital patient is 10 years younger than it was in our January fall surge. Remember, getting vaccinated and wearing a mask are your best defenses against this virus. Let me turn it over now to Judge Wolff.
Thank you, Mayor. I think it's important for everybody to realize we're still in a very difficult time. When you look at the fact that our weekly moving average of cases per 10,000 went from 36 to 69, yes, the positivity rate went down some. That's because we're testing more and they're beginning to test in school. So that percentage will go down, but the cases per 10,000 had a dramatic increase, almost not quite doubling, but close to doubling. We've done about 1,000 infusions of Regeneron out at the Bexar County Expo Hall. And one day we hit as high as 100. We'd never been that high before. So people are taking advantage of going out, getting the Regeneron, and hopefully not getting any sicker because they took it and not being able and not end up in the hospital. And I think we're starting to see some impact of that. Our hospital numbers kind of go up one day, down one day, but they're still at a very, very dangerous level, over 1,416, something like that. Now, to give you a sense of why people that are not vaccinated are much more dangerous. The CDC study showed you're 29 times likely to be in the hospital if you are unvaccinated. 29 times. And then if you pass it on, you're 5 times more likely to get infected if you're unvaccinated. So vaccinations are the key to the game. I think we got a really good positive step when the FDA gave final approval to Pfizer. That was one concern that people had, that they didn't want to get it till that happened. That has happened. We hope that you will go ahead and get it. The Attorney General has appealed our fourth court ruling. I'm not sure when they will make a decision, but it is apparently now in the Supreme Court. We are beginning to have a problem at the jail, and it's caused by the state again. We have 86 people in the jail today that are positive, but what is dramatically causing our problem is overcrowding. We had a low of like 3,000 people in the jail at one time during the pandemic. Today we have 4,376. Why do we have so many? Well, 700 and some of them have been there long enough to be able to go in the prison system. Prison system hadn't been taken, very, very few, so they're still stuck in our jail. Some of the rulings that the governor did to make it harder to give a PR bond to misdemeanors has driven our jail population up. So they may have a problem in the prison with COVID, but what are they doing? They're shoving it right down to our level, putting our community in jeopardy. We've written a letter to the governor to state our problem. I'm sure we won't hear anything positive about it, but we are at least bringing it to their attention. I think that's it for me.
Thank you, Judge. And as a reminder, we do encourage you, if you're having symptoms, to protect yourself and others, wear a mask, etc. Also, find a testing location by visiting covid19.sanantonio.gov. You can also call the COVID-19 hotline at 311 and select option 8 for a testing location. As a reminder, again, we are in the midst of this, and we are working hard as a community to get this back under control and to protect the health and safety of everyone around us. So please wear a mask and get vaccinated. Do it for you, do it for your family, and do it for San Antonio. You can also get the latest updates on COVID by going to the website covid19.sanantonio.gov or by texting COSAGOV to 55000. Claude, myself, the judge, and Andy, our city attorney, are here for questions.
Dr. Jacob, earlier today, Senator Cornyn announced that $3.8 million is coming to the city of San Antonio for vaccinations. Have y'all received word of that funding? And if so, how do y'all plan to use that money?
Thank you for the question. That does not sound like an update that we've received, so we have been reporting out systematically about any grant funding that we've received, but I have not received the official word about that grant award. And as soon as we do, we'll make sure to issue a statement or an announcement about that. But just know that on the ground, any resources that we are able to mobilize to help support our COVID response efforts, it allows us to be to pivot, to make sure that we can get shots in arms and that we can continue to amplify our messaging with our partners.
Mayor, you mentioned an increase in testing. Have y'all revived any contracts with community labs, or where is that increased testing coming from?
Let me turn it to Claude to talk about testing availability. I know that we had resumed testing even at our hospital, but we do have testing locations available, I think, at 13 sites now. Claude, if you can talk a little bit about that.
Right. So ongoing testing sites, we have 13 free testing sites across the county. We do provide that still free of charge. What we do have on our website is a map that shows what the different testing locations are. So we'll make sure to have folks go to covid19.gov just to make sure to talk about and to see the testing locations. So they are available, they're free of charge, and that's an ongoing resource that we make available to residents.
Mayor,
Another $1 million for community labs.
Mayor, now we know that the governor again is going before the Supreme Court, Texas Supreme Court, trying to invalidate whatever you're doing over here. What is the level? I mean, we've been, going on and off since August the 10th when Antonio Arteaga issued the TRO in your favor. And now you see again the governor trying to, undo whatever you're doing over here. What is the level of frustration at this moment?
At the governor?
Everything that
Well, no, the judge and I, from the very beginning of this pandemic, we say it over and over again, have been guided by our medical professionals. We are, and we remain, trying to keep our community safe, to try to keep our kids safe. That is our motivation. At this point, it's really difficult to say what the motivations of the governor are, but they're clearly not that.
And this is for Andy, the city attorney. So you have the advantage as of right now, but again, the governor and the district attorney's offices, they went before that. What is going to be next? What is the first thing that can happen after they ask for that?
Well, again, to level set, we did have the Fourth Court of Appeals confirm that our temporary injunction remains in place. Yesterday, the governor and the attorney general filed with the Texas Supreme Court asking for them to provide emergency relief to essentially lift our temporary injunction and invalidate it. The Supreme Court did reach out to us, and they have given us until noon tomorrow to submit a response to the AG's filing. Obviously, we will do that. And once again, we will highlight the fact that, in our view, the governor is inappropriately using his emergency powers, which are there to facilitate action, and he's using them to prohibit action.
You're using the Texas Disaster Act as the mainframe of, what you're doing right here.
Correct.
Isn't the governor, or in the state of Texas, doesn't he have the last word when it comes to things like this? And is not, or in the legal framework of this, that is not within his power?
That's a good question, actually. But the power is, again, within the framework that was set up by the legislature, which, again, it's there to provide the governor, it's there to provide local entities the ability to act, to mitigate, to address a disaster, to respond to a disaster. And again, it's an inappropriate use of those emergency powers if the only thing you do with those powers is prohibit action, prohibit unnecessary action. So again, that's the legal basis of our argument, is an appropriate use of emergency powers is to facilitate response, be that by the state, by local entities, by our health authorities. We need to respond to a disaster, not simply have our hands tied.
Let me just add one quick thing. Tell me, Andy, if I'm wrong. If we were to lose in the Supreme Court, some of the school districts, I think there's over 70 now across the state, have stated that they're going to mandate it anyway, with it, whatever the governor said. Of course, they'll be sued too, I guess. Here locally, three school boards, Northeast, North Side, and Alamo Heights, their school board voted to mandate masks. Now, what they will do if we are turned over, I don't know, but I know some of them across the state say they're going to do it regardless of what the governor says.
For anyone on the panel, what message do you have for parents who are concerned because their children do not have access to the vaccine?
Well, continue to trust in the medical professionals and the guidance they're giving us, which is exactly what the school boards named by the judge and most of the school boards in Bexar County now have said they're going to do, and requiring masks on campus. That's the job of everybody in this community, to protect young people at this point. So the message is, if you're eligible to be vaccinated, get vaccinated and wear a mask regardless.
Y'all mentioned that there were 44 children that are in the hospitals. Do y'all have the age breakdown of hospitalizations yet from STRAC? And if not, what's the holdup?
Age breakdown of the pediatric.
Right. The actual number is 24 that we have
24.
pediatric cases, not 44. and we can find out the actual breakdown of those ages. So that's reported to us by our healthcare partners, so we can at least acknowledge there are 24 pediatric cases currently of COVID-positive patients.
And let me add to that, that there's a lot of kids also that have RSV, a respiratory virus, that the face mask also protects them against that virus. So, you know, the combination of those two, you know, are very dangerous for children.
Do we know the availability of ICU in local hospitals?
Well, we're what, 400 and some odd? I know we got, what did we get, 200 and some odd nurses and then another 300 coming. I know what University Hospital does. If they got the staff and the nurses, they convert one of their regular patients' rooms into an ICU unit. And I know in some cases, I believe they, it's at best to have one nurse per patient. Sometimes they have to have a nurse per two patients.
For Dr. Jacob, are San Antonio hospitals able to accept patients from rural communities that do not have ICU or ER capacity?
As you've heard, we've been talking about the pressures experienced by the healthcare systems, and so there is a way to redirect some of the patient flow. So yes, the hospitals have some capacity, but just know that for the last few weeks, we've been reporting out about the incredible duress that hospitals have been experiencing. So just know that there are networks, there are processes for at least balancing the respective load that these hospitals experience. So for now, there is a movement afoot to have additional personnel support these hospitals, and it's a balance between what's happening here in San Antonio and the more rural parts of the county.
Do you have advice for rural healthcare providers who don't have the resources to adequately care for their patients?
Well, we got to send them to an urban area. I think as a general rule, give or take a percent or two, 20% of the patients that are in our hospitals come from the surrounding area. And most of all our surrounding area is rural, and so a lot of them are coming to the urban areas.
Yeah, and we've requested, STRAC has requested, I think, 2,000 nurses. We've received a little over 600, but
600,
a couple
yeah.
hundred of those have gone to rural areas.
right.
So there's clearly, and we've said before, it's not an equipment issue so much as it is a staffing issue.
Yeah.
And so we're needing personnel just like the rest of the state is. We have equipment, but we need people to run it.
So is that many nurses and staff that San Antonio hospitals need that you asked for 2,000?
Well, you know, I'm not going to speak for the hospitals, but again, they are requesting personnel, so there's availability for the surge. And we know that they have suspended some elective surgeries. They've rescheduled others. They're doing what they can internally in each of those facilities to make space and to absorb the crush of patients that they're seeing as a result of the additional COVID patients. So they're doing what they have to do internally, but we want to relieve that pressure just like every other hospital district, hospital system in the state is.
Do we know where those nurses are coming from?
They're from the contracts that they have that we made through the STAR request. So they're state.
These are state resources redeployed to us, so that's where those nurses are coming from. And again, as the mayor mentioned, about a third of the ones that we received, so over 600 so far, about a third of those have been redeployed to the more rural parts of the county.
Dr. Jacob, I know you don't have a crystal ball, but given that colleges are starting to welcome back their students this week and next week, are you all anticipating or preparing for even more cases that could be reported or more hospitalizations? And if so, is there any type of intervention or messaging that Metro Health is working with the different universities?
Well, the take-home message is get vaccinated. As you've heard, in terms of the drop in our positivity rate, we do know that a number of these universities and a lot of these schools are testing more, so that's an inflator of sorts, but it drives down our positivity rate. The message is still the same. Get vaccinated, mask up, and we are in close contact with our university partners, so we report out not only the trends and the pressures that the hospitals are feeling, but we're also in this space seeing the back-to-school wave, not just the middle schools, but also the universities. So same message, we stay on message, and we're just working with our partners on the ground.
And are y'all anticipating or predicting an increase in cases?
Well, the crystal ball question. So again, it's all COVID all the time. Just imagine where we were a few weeks ago. We've known since the 4th of July, we've seen this acceleration of cases. We're trying to get to Labor Day and beyond. So we're taking it day by day, but as we report out, just like we've seen the 7-day moving average has dropped, but we've also seen at least the cases, the hospitalizations has gone up, and at least the case rate per 100,000 has also gone up. So that's what we see, and it's different than where we were, say, a week ago. So it goes up and down is really the long answer to your question.
And people might be asking, well, how long is this going to go on? And as a reminder, the vaccine is eligible only for people 12 and up. And of that population, I read in the United States, we have 82-something million people that are eligible for the vaccine that are not getting it. And so when you couple that with the many thousands of people in our own community that are not even eligible yet, the children under 12, we're only halfway there in terms of getting vaccinated. We need everybody who's eligible to get vaccinated to go do it, because you are prolonging this crisis the further you stay on the sidelines as for whatever reason it is. So don't do that. If our interest is getting back to reviving the economy, doing all the activities that we love, getting our masks off in school, get vaccinated.
It's only been 36 hours since the FDA announced approval for the Pfizer vaccine. Since then, has the Alamo Dome, has the Alamo Dome or any other vaccination sites seen an increase maybe today or yesterday in the number of people since the authorization was given?
So just know that some providers have already been giving out the third dose. Again, based on one's status and whether or not they're immunocompromised, we have not seen in the last 36 hours increased foot traffic, although we have been reporting out over the last few weeks that incrementally we've seen an uptick, whether it's in COVID testing or even visits to the Alamo Dome. So we have not seen that surge as of yet in terms of the folks who want to get that booster shot. But just know that with the FDA approval, there is a window by mid-September when we expect to see at least more activity, which is why we're mobilizing with our area partners, with the pharmacies, with the provider networks, just to make sure that they're ready to help us at least get shots in arms for those that are ready to get vaccinated, at least starting in September. But just know that there are already a certain part of about 3% of the population who are eligible because they're immunocompromised. They're already getting that third dose.
And for people, yesterday the FDA had said that that the Pfizer vaccine would no longer have the emergency use authorization, that it was just fully FDA approved. So since then, have you seen, we had a lot of people that were holdouts saying they wanted the full FDA approval before they got the vaccine. Has there been any increase in that regard?
Just to clarify that the FDA approval was for those 16 years and older. Just know that the emergency use authorization is still in effect for those 12 to 15 getting the Pfizer vaccine. So just to clarify that point. But I just want to make sure, what was the other part of your question?
Basically, because there were so many people that were holdouts of just the emergency use authorization, now that it has full clearance from the FDA, do you anticipate more people to show up, or have you seen more people show up?
Well, not seen as of yet. We do hope that folks do show up. We have seen, again, incremental increase over the last few weeks. We've been on message reminding folks about the value of being vaccinated. We've been talking about the pressures that the hospitals have experienced, that this has been a pandemic of the unvaccinated. So we'll see what happens over the next few days and weeks, but just know we have not seen increased foot traffic as of yet, but we expect that to happen over the course of the coming weeks.
Judge Wolff, what was that you said about more money for community labs?
We had $1 million that we had appropriated for community labs that we have approved through the American Recovery dollars. I think we voted on that this week or week before, $1 million extra dollars.
Can y'all speak to the role that BAMC or SAMC has played in this crisis recently?
Well, BAMC has always, and even in the crisis, plays a critical role in relieving trauma patients. And what we know is that they're under incredible pressure now as well because they're receiving trauma patients from a 22-county mile-wide region. And what that does is for our hospital system here locally in San Antonio in particular, but also those areas around us, freeing up beds, space, because they're taking on more trauma patients means that those local hospitals now can treat other conditions like COVID. So they are incredibly important for us locally. Now we do know that the DoD is sending contingents of nurses from DoD hospitals to other regions to relieve pressure. We have made certain that they understand at the DoD that BAMC is such an incredible importance, has incredible importance to the entire region here in San Antonio, and our needs obviously are top of mind for them.
Let me say one quick thing about the military. Order went out, I think yesterday, that have the 1.4 million military personnel have to get vaccinated, active duty. And I don't know exactly how many military personnel here, but we've got thousands of them here between the bases. So that's going to help us because they're going to have to get their vaccine, and they do come out into our community.
Judge, earlier today you talked about, or at the Commissioner's Court, they talked about how Wonderland of Americas would reopen that site for booster shots September 20. Can you tell us, will those be available to anybody who is eligible within that 8 months since their last dose?
Well,
Or,
I think what Claude was saying, I think the middle of September they're going to approve the booster shots for everybody, I think. And so I know they're looking at trying to get it open for that. Right now, just a small group are available for the booster shot, but we think by the middle of September, it'll be open to everybody, and I think that's their target date to get going, I believe.
That's all we have tonight. Thank you.
All right, thank you.
you.